Cullen's killing spree finally ended because of one persistent detective who refused to look away. Tim Braun of the Somerset County Prosecutor's Office noticed an unusual pattern at Somerset Medical Center in 2003. Patients were dying of heart problems they shouldn't have had. Healthy people recovering from routine procedures were suddenly coding. Something was wrong. Braun started pulling medication records. What he found was shocking. Someone had been ordering massive, unexplained amounts of digoxin and other cardiac medications. Medications that weren't prescribed to any patients. The orders all traced back to one nurse, Charles Cullen, December 12, 2003. Detectives brought Charles Cullen in for questioning. He sat across from investigators, calm and composed. When confronted with the evidence, the medication records, and the patient deaths, the pattern spanning hospitals, he initially denied everything. "I'm a nurse. I save lives. I would never hurt anyone." But after hours of interrogation, something broke. Maybe it was exhaustion. Maybe it was relief. The mask cracked. "Okay," he said quietly. "I'll tell you what I did." What came next was one of the most chilling confessions in American criminal history. Cullen started talking about murders. Not one, not two, 40 victims across nearly 2 decades. He described them in clinical detail. Which hospitals, which medications, which patients. A 91-year-old priest, a 21-year-old car accident victim, a woman recovering from routine surgery. He kept a mental catalog of death, names, dates, methods. He spoke about murder the way someone might discuss their daily routine. Calm, detached, matter of fact. When asked why, his explanation was chilling in its banality. "I was relieving their suffering." But his victims weren't all terminal patients. Many were recovering well. Some were scheduled to go home soon. They weren't suffering until Charles Cullen decided to end their lives. Psychiatrists who evaluated Cullen found a deeply troubled man. Multiple suicide attempts, failed marriages, severe depression. His own life was a series of failures and pain. But nothing explained why he chose to murder helpless patients instead of seeking help. He described feeling a compulsion to kill, but couldn't articulate why. He'd attempted suicide multiple times, but always survived. So instead of ending his own suffering, he ended others. The truth psychiatrists discovered was simple and terrifying. Charles Cullen killed because he could, because hospitals protected themselves instead of patients, because the system failed spectacularly for 16 years, and because taking life gave him a sense of control he lacked everywhere else.